It is my pleasure to have with us today Robbie Branch, who has served as the transplant coordinator at Cleveland Clinic since 2018. Thank you, Robbie, for joining us. I'll be asking her to describe her profession in just a little bit, but for now, I'd like to introduce our patient panelists. First, I'm going to start with Zachary Malo.
Hello.
Zach, tell us a little bit about your Alport journey.
Yep, so I'm Zachary Malo. I live in Rhode Island, and I'm now 3 years post-transplant. So I was diagnosed with Alport syndrome very young age. I'm now the third generation of known Alport syndrome patient. So I have 3 uncles who have now been transplanted. I took ACE inhibitors as an adolescent. And then, in my mid-20s, I started having issues with hearing and vision, kidney-related issues, found out my kidneys had failed, went on peritoneal dialysis for 9 months before I had a living donor transplant. My partner and we actually just recently got married on our 3rd kidneyversary just this past May.
Well, congratulations, Zach. That's fantastic. Maddison, would you mind sharing a little bit about your Alport journey?
Hi, everyone. I'm Maddie Martin. I am 21 years old. I am 1 year and 1 month post-transplant from a living donor transplant. I was diagnosed with Alports at age 4. I started having difficulty with my hearing at age 10 and was fitted with hearing aids. And then I started having, I took ACE inhibitors all throughout my childhood and into adolescence. And then when I was 18, I started having problems with my kidneys, and I received a living donor transplant from my high school attendance secretary when I was 20 years old.
Fantastic. She's a great person for doing that. And lastly, Ryan, if you could tell us a little bit about your Alport journey. I believe you're unique in our panel in that you've had not 1, but 2 renal transplants. Let's hear from Ryan.
Thanks, Kevin. Yep, I'm a 2-time recipient of the transplant. I am an X-linked Alport patient. Grew up in Minnesota area, now living in San Diego, California. I actually, because so many years ago, living in Minnesota, I actually was fortunate enough to meet Dr. Kashtian at a relatively young age, in my early teens, where I was officially diagnosed with Alport syndrome. Initially, I started losing my hearing around age 5, 6. And they could never really put 2 and 2 together until I was able to meet Dr. Kashtian. So I had my first living donor transplant in 2009, 1997, and my second living donor transplant in 2009. So very fortunate. My mother was my first donor, and my older sister was my second donor. So very blessed.
Fantastic. Well, we're very grateful for both of them for their gift of life donations. We're glad you're here, Ryan, Zachary, and Maddison. I'd like to turn our attention now to our expert for the panel, Robbie Ferguson-Branch. So Robbie, if you mind telling us a little bit exactly what your position as pre-transplant coordinator entails. And secondly, what's your #1 goal when you first meet with a pre-transplant patient?
Okay, thank you so much for having me. This is my 2nd year with you guys, and I just enjoy it. So thank you so much for having me. Let me say that first. I've been a pre-transplant coordinator for 2 years. First of all, my tasks are very many, but I'll simplify it by saying we're the first hands on your referral once it's made by a nephrologist. We review your I'm sorry, am I losing you guys? Looks like I've gone out.
Robbie, we can still hear you. You can still continue, and we'll work on your camera. You can continue telling us your role as transplant coordinator.
Okay, thank you. So I review the referrals that are made by the nephrologist and then get the process started for evaluation, which means getting potential recipients scheduled in to see an evaluating team. When they come in for the team, we'll do education about kidney transplant. I provide information to the physicians about the medical history of the recipients. I am a part of getting appointments made for consultation and testing that are necessary to make a determination for potential recipients. I am a pre-transplant coordinator, which means I follow the patient all the way until they are presented to the committee history is presented to the committee, decision is made to have the patient added to the kidney transplant waiting list. And then when they're added to the waiting list, we follow them until they are actually transplanted. And then it goes on to an inpatient coordinator and a post-transplant coordinator. When you ask, what is my number one goal when first meeting a patient or a potential recipient, I should say, my goal is always to initiate a bond with that potential recipient that comes in, to give them as much education as they need regarding kidney transplant, to make them comfortable and just aid them and assist them in this entire process. I am the person of contact for everything that a recipient needs until they're actually transplanted.
Sounds great. And I'd like to just shout out to all pre-transplant coordinators out there. I know without them, my life and Ryan's and Zachary's and Maddison's would have been a lot tougher. So thank you all for your hard work. So my next question, I'm going to turn it right away to Zachary. I wanted to ask Zach what it's like to receive a living donation from someone who you're very close with, as opposed to if it was a total stranger or maybe a distant family member. This is someone who's very much a part of your personal life.
Yeah, so it was definitely an interesting experience. As I started into my search for a potential donor, I had a close family member also reach out in interest to donate to me. That obviously did not work out. So my partner Michael was the next choice, and the way we always treated it was that he could always make a decision to drop out whenever he wanted. And also when working with our transplant hospital, we definitely had two separate teams entirely. So we live in Rhode Island. Our transplant hospital was up in Boston. So with Boston traffic, we would try and make a day out of it, schedule our appointments at the same time. But when we got to the hospital, things were very, nice to meet you, but I don't want to speak to you. They treated it completely separately, which made me feel better that he had his own team looking out for his interests. If for some reason things weren't going to work out with Michael, I wanted his team to help him make that decision completely separate from me. So, I was always appreciative that he had people looking out. Obviously things went well. He did donate his kidney to me. And now, we're married. So part of it now is like, if we bicker, he'll show me his scar. And then, the argument usually ends there. So he wins the life.
Fantastic. Thank you for sharing that, Zachary. Ryan, I'd like to, a little bit related to Zachary's story, as you had two transplants, both from family members. I know myself as a transplant recipient and other transplant recipients can feel almost a little bit of guilt. Can you discuss maybe your feelings about maybe feeling like a burden to your family? They did some tremendous acts of self-sacrifice, in a way for you, and how that kind of weighs on you mentally.
Yeah, I mean, older sister, younger brother rivalry, right? So I didn't really care. I mean, just you'll deal with it. It was, to this day, it's an emotional thing, right? It's every April when that transplant date comes by, you can't help but reflect on the sacrifice that they've made. And, in our family, because I'm X-linked, my sister didn't get it. And, when my first transplant came around, she was way too young. She had made a decision later in life then not to have children because there's always a potential she could pass it on to one of her boys. And so she had kind of reached that point in life, luckily for me, and could make that decision on her own. But, it's hard. You definitely feel like it's a burden. She was in the middle of her career. She had to make some pretty big sacrifices to do this. And there is no way you will ever repay anybody for doing that for you. It's such a monumental thing to give of that nature. We still have our rivalry, but, I will be ever grateful for her and for my mom what they did.
Fantastic. I'm going to turn my next question over to Maddison. We're going to continue with a little bit about the mental health aspects of receiving a living donor kidney transplant. So Maddison, if you mind sharing a little bit about your experiences post-transplant, and even post-transplant, you'll have good days and bad days. Certainly you're doing much better health-wise, but your mental health can fluctuate quite a bit, certainly before and immediately after kidney transplant. So if you wouldn't mind sharing with our community a little bit about your experience there.
Yeah, of course. So I think one of the things that I really struggled with was the gratitude aspect, because obviously you have so much gratitude because this is a gift of life, and you wouldn't really be there without this person making the sacrifice for you. So I certainly felt that to the extreme, but I did have days where I struggled with the lifestyle changes that I had to make, the medications, the water, just the changes in general. Going to doctor's appointments several times a week. It's just a lot of transitioning after transplant, and that wasn't something that I was necessarily prepared for. Anyways, I was so focused pre-transplant on getting a kidney and getting a transplant, and I didn't really anticipate what would happen after and the changes that would be made afterwards. And I really hadn't coped with my kidney failure in the beginning because I really was in survival mode and was trying to find a kidney. So a lot of that caught up with me after transplant, and I really had to allow myself to feel frustrated and feel just have bad days and have bad emotions, and I had to be able to let myself process those emotions, despite the fact that I'm grateful. And it doesn't take away from the gratitude at all, which I had to learn. But it really is, I'm still human. I still need to live my life for me and not for my donor. And it's okay to have those feelings. And that's something that I really learned and was not anticipating learning.
Thank you for sharing that, Maddison. As Zachary attested to, his own donor, you can still quarrel with them. And, again, we're all human, and those relationships can change. But again, nothing will change the fact that someone gave the gift of life. I'm going to switch over to Robbie for our next question. We did receive an audience question here that wants to know a little bit more about GFR. And if there's maybe a magic number or GFR or a range that once someone is in that GFR range, we really start having that talk about dialysis.
Mm-hmm. Sure. So once a person has a GFR of lower than 20%, you are officially eligible to be added to the kidney transplant waiting list. Okay. Now, as far as dialysis, as that number decreases and you go into the single digits, then your nephrologist will walk you through whether or not it's time to start dialysis. Some people become very symptomatic as far as dealing with weakness, nausea, and things like that, vomiting, becoming very ill. And at that point, it can become emergently necessary that you start dialysis. Some people are unaware of their symptoms and have to start dialysis inpatient or in the emergency room. So they want you, it's highly recommended that you have a good relationship with your nephrologist so that they can monitor your GFR and determine whether or not it's time for you to be evaluated for kidney transplant or start dialysis.
Fantastic. I'm going to address my next question to you as well, Robbie, if you don't mind. The next question we had from our community here relates to preemptive transplants, which are, generally speaking, the best possible option. Could you explain what a preemptive transplant means to our community and why they're so important?
Okay, so with a preemptive transplant, that means that the potential recipient is still making urine. That means they have not started dialysis. When there is a preemptive transplant, that means that you're going to have greater chances of success. Okay, so that's going to be the best possible way to be transplanted if it's within your control. So again, if you have a great relationship with your nephrologist and they're kind of walking you through this, then you can decide when you need to go ahead and if you have a living donor, be transplanted. I've had patients that were transplanted. They kind of waited till they got to about 15%. They were not at risk of needing to start dialysis at that time and had a living donor. So that's a good opportunity for you to go ahead and have a transplant if you've already been placed on the waiting list. Okay, because that is going to be your best outcome. Living donor transplants last an average of 15 to 20 years. deceased donor transplant lasts average of 10 to 15 years. Living donor is going to always be the best option if you have that opportunity.
Fantastic. Because we have such a great array of panelists here with us today, I'm going to ask everyone, starting with Zach, if there's one piece of advice they can give to folks that are just starting the whole pre-transplant journey, what would it be?
So I would say definitely listen to your body and listen to your nephrologist. I didn't necessarily do that. I hid symptoms for a while, just assuming that I might have been ill. And like Robbie said, you definitely want to catch those symptoms early, speak to your nephrologist, because I was one of those people that had to go into the emergency room and started dialysis very abruptly, just because I didn't necessarily do that. Great.
Ryan, can you mind sharing some tips?
Yeah, I think, Zach kind of nailed it. I would say the other thing is kind of know the process. It can be, at that time, in that emotional state, it's kind of hard to grasp everything that is coming at you. And it varies for everybody. Some people can go years leading up to that point where they have to make that decision. Others, after my first transplant, because it was not my native kidney, seemed to progress much quickly, which means I was on dialysis much faster. And so I think it's just know the process, understand what's coming ahead of you, and give yourself some time to kind of get your head around all the different things, because like Zach mentioned, you got to be listening to your body, right? Everybody is different. There's no two people are going to go through the same process it relates to dialysis. So you have got to listen to your body and feed it right and do all the normal things you should be doing in terms of sleeping and eating and all that.
Great. Maddison?
My best advice would be to talk to another transplant patient. Join the Alport Syndrome Foundation Facebook page, or join another transplant forum and talk to someone who has experienced it before. In my case, I'm the only one in my family who has Alports, and the only one in my family who needed a transplant. And while my family was so overwhelmingly supportive, no one knew what it felt like inside my body, or what I was going through, or what my emotions were. They didn't truly understand because they hadn't experienced it before. So I would say the most validating thing is really you talk to a transplant patient and ask them questions and see what they've been through. And I guarantee you the feelings that they had, the thoughts they had are very similar to the ones you're having.
Great, thank you, Maddison. My next question is for Robbie. If you could just give an overview for our listeners today about the types of tests a potential donor, a living donor, may have to go through, and just talk a little bit about when folks discuss matching, or your donor has to match, what exactly those things mean.
Okay, sure. So the evaluation for a potential recipient and a living donor are really quite similar. They're going to have to do standard pre-op testing such as EKG, chest x-ray, CAT scan of your abdomen and pelvis. Consultations vary, okay? For recipients, depending on their medical history, the nephrologist that evaluates the recipient will determine whether or not they need to see a cardiologist, whether or not they need to see oncology, whether or not they need to see, rheumatology, just various consultations to make sure that we are safely going to be able to transplant, or that this patient is a suitable candidate for transplant, okay? Our goal is definitely to keep any recipient safe, okay, surgically. As far as the donor, that is also the top priority. So they also will be, they'll evaluate their urine output. They'll evaluate whether or not they are putting out protein and things of that sort in their urine to determine whether or not this is something that they may be looking at in their future as well. What kind of medications are the donors taking? Are they at high risk to have end-stage renal disease themselves? If that's the case, they would be eliminated. Things like weight can be worked worked on. We definitely have a BMI criteria for both donor and for recipient, but those are things that can be managed. But things like medications that you're required to take because of different comorbidities that the donor may have can pose a problem. So again, we want to make sure that we don't cause any problems to any donors that are trying to do this awesome thing by donating their kidney. And the second question that you asked, could you repeat that for me, Kevin?
Well, sure. We were just trying to better familiarize our viewers and listeners to that process. So you did mention a few of the exclusions. Naturally, someone who is suspected of kidney disease or is likely to progress to kidney disease, such as an Alport syndrome patient, would be automatically disqualified as a donor, such as anyone who would have a history maybe of cancer. Are there any other exclusions maybe off the top of your head that would automatically be a no for someone as a potential donor?
Sometimes hypertension. If you're taking multiple blood pressure medications, if you are required to take 3 blood pressure medications or 2 blood pressure medications, we know that hypertension can also lead to kidney failure. So that would be a person that we would be putting at high risk to also need a kidney transplant. That is something that would probably disqualify. Sometimes there are things that are worked out that the physicians can kind of make changes, but hypertension requiring multiple blood pressure medications to control your blood pressure is probably going to be something that stops as well.
Okay, great. We're going to switch topics a little bit here and discuss about the current health crisis, the COVID-19 crisis. And I'm going to do kind of go around the room here and ask. I'll start with Brian. What type of changes have there been to your lifestyle as someone who is immunocompromised? And how this current crisis has affected maybe your day-to-day activities more than someone else.
Yeah, I mean, at the end of the day, being a transplant patient, you're always more cognizant of germs and period, right? I mean, just being around sick people, going anywhere where there might be massive crowds. I mean, you just are probably a little bit more on edge knowing that you're more susceptible to picking those things up. So I think when COVID hit, I work in a large manufacturing facility with 1,000 employees, and it was like, I'm out of there. And have been kind of hunkering down since. I have young children, so there was a lot of coaching and parenting and keeping my kids home. I think like most people, we've gotten a little and what that fine line is between having somewhat of a life, but yet still being very cautious. And, we're going to continue to walk that fine line in our house to make sure that there's no risk. Actually, a fellow Alport patient friend of mine who I've known for many years reached out to me about a month and a half ago, and he mentioned that he did get COVID back in March. And he said it was not fun, much like any flu-like disease can be, but he and his family all went through it, and he's doing well. So I think that helped have another perspective about transplant patients, immunocompromised people getting it. I've had subsequent conversations with my nephrologist about it, in terms of my risk level. And, that open communication has kind of helped put me at ease a little bit as well.
Great. Maddison, what about you?
So the way that the time that COVID kind of hit, so I just had my transplant a year ago in last June. So I was already pretty much quarantined post-transplant because that's when you're most immunocompromised. So I was quarantined probably until about like January. I pretty much was home. I took classes from home in the fall semester, and I pretty much, I was cautious. I pretty much was quarantined and stayed to myself anyways. And then I had just gone back to college in January and February. And then in the middle of March, I had to come home again just because I didn't want to be on my own up at my apartment with the fear of like going to the grocery store and stuff when it was big. So I kind of re-entered quarantine, and I have been hunkered down ever since. It just kind of in my home. I work for a medical group, and they have allowed me to work remotely from a computer. So yeah, it didn't really change much just because I had just kind of come out of quarantine, you could say, and kind of went back into it. So I'm fine with it. But yeah, didn't really have to change much.
Great. What about you, Zachary?
like my other fellow panelists, I'm trying to stay as safe as possible. I'm lucky enough to work for a business that allows me to work from home. Welcome to my office. So I've been here more or less since March 12th. We've had to obviously change some things around with our life. We had our wedding scheduled for our kidneyversary, which was this past May. And obviously things didn't necessarily work out the way we had envisioned. So, we regrouped. The date was extremely important to us. So we ended up getting married just in our yard. But it was, that special date that mattered for us the most. Since then, though, I try to avoid stores as much as I can. Michael will go shopping for us. And, I'm trying to venture out as much as I can while still also being safe, keeping hand sanitizer with me, obviously masking up wherever I go, things like that.
Sure. My next question, I would send over to Ryan. If he would mind sharing a little bit about maybe his diet during the time period when his kidneys were in decline. And then after post-transplant, once he was able to have a more liberal menu, if you would, how some of those things affected his daily eating habits.
Really big hamburgers, like massive. I think that was probably one of the toughest things to adjust to is trying to refine the dialysis process. I did hemodialysis in a clinic, so I was in 3 days a week, 4 hours at a time. And dialing in that diet was probably the hardest thing. Within a week of transplant, I had about 30 pounds of fluid that came off of me. So it shows you it's not a perfect science. And I was very restrictive of my diet. I mean, that's just kind of how I live my life anyway. So adjusting to that, it wasn't fun, but I knew it was imperative that I do that and very necessary so that dialysis wasn't so bad. Because the more you try to cheat or go outside the boundaries of putting things in your body, that much harder it is to get them back out because your kidney is not doing it. You're relying on a machine and, a machine's a machine. So it was a little adjustment. I think after it took me a while, but I had lost so much weight just through atrophy and fluid loss that I was really skinny when I came out of my second transplant specifically. And so it was kind of like, as I felt better, I would just add more and more foods back into my diet. And, a while ago, about a year ago now, my wife and I decided that being vegetarian was probably the best idea for us. We just felt better, getting older and a lot of things out there about meat, processing. And I got to tell you, I mean, we still enjoy food very much. We both are avid cooks, but everything in moderation. That's kind of our rule.
On a lighter note, Maddison, do you remember what your first meal was? Maybe your first whole foods meal, I should say, not a liquid, after dialysis, after transplant. Was there maybe one food that you had been craving for a long time that you couldn't have and you were finally able to have it? You remember just like that feeling of success?
There wasn't one food in particular that I remember not being able to have and then having afterwards, but I do remember I had just come out of surgery and I had like small procedures before, so I kind of knew how I was with anesthesia, and most people are nauseous after anesthesia and I'm not. I am like a big eater in general, so I get really hungry afterwards. So I remember my nurse coming in and I was like, I need to eat something. Like, can I please eat? I'm still kind of loopy from the anesthesia. And she's like, I'm going to bring in some saltines for you. I'm like, I don't want saltines. Like, I'm like cursing at her. Like, I don't want saltines. I want something real. So she brought me in a turkey sandwich, which wasn't, I mean, it was hospital grade, so it wasn't the greatest, but I was so like grateful to have that actual turkey sandwich right after I had my surgery.
That's great. I mean, for me personally, I had missed tomatoes. So my first non-whole food item was just a tomato soup in the hospital. And it was heavenly, to be honest. I see you guys shaking your heads. So you all understand. As transplant patients are forced to take immunosuppressant medication for the remainder of their lives or the life of the transplant, that can certainly be an added burden to every day. Zachary, do you have any tips at all to remind yourself to take those pills every day as they're so very important?
Yep. So I do keep an app on my phone that reminds me, 9 a.m., 9 p.m. I take my pills. I also usually walk around with a pill holder that I keep the next dose. You know, if I'm going to go out somewhere, I will always keep that pill holder with me just in case. One thing before all of this going on right now, I traveled a lot for work. So traveling between time zones was always difficult for me. So I had very specific conversations with my nephrologist and my post-transplant team about what to do. They were a little more nervous early on, but a couple years out, they usually say, adjust to the time zone. You can go a couple extra hours, and then as I come back, I'll gradually get back into the normal 12-hour intervals that I would normally take them.
Zach, that's a great point. Every time it's daylight savings time, I personally panic to think about, oh no, now my pill times are wrong. But like you said, setting reminders for yourself or using an app are certainly great ways to do that. One other thing I wanted to talk about when we come to transplant is the possibility of rejection. And I'm going to pass that question over to Robbie to just describe to our listeners what exactly is an organ or a graft rejection and what can be done to potentially help keep that transplanted organ.
Well, organ rejection, what that means is that your body is actually trying to fight against the organ that has been transplanted, okay? And so you'll have several different symptoms indicating that something is going on. That would lead to a possible admission for high doses of immunosuppression medication, as well as steroids to control the rejection. It can be treated sometimes, and sometimes, unfortunately, it can lead to a loss of that transplanted organ. The things that you can do to keep prevent yourself from going into rejection that are within your control are just making sure that you are taking your medication appropriately and communicating with your post-transplant coordinator, keeping your appointments with your physicians, lab work and things of that sort so that they can monitor what's going on with you.
Great. I'm going to shift attention back to dialysis for a minute. I know we had some discussions about Ryan sharing his experience with hemodialysis. Robbie, would you mind giving our listeners just a very quick overview of the types of dialysis, hemodialysis versus peritoneal dialysis?
Okay, so with hemodialysis, that's going to require that you have an access. Okay, there's multiple types of access that you can have that you'll use to do dialysis with. You can either do home dialysis with hemodialysis, or you can do inpatient, in-house dialysis, meaning that you would be required to go to a center multiple times throughout the week, depending on the prescription that the nephrologist has made for you. And then peritoneal dialysis, that is going to be where a device is entered into your abdomen that will allow you to remove fluid. That is within your control, and you can do that at home. Okay, so you would not need to go inpatient.
Great. Do you have any tips for patients to maybe best advocate for their care or best advocate for the type of dialysis that would work best for them?
Well, part of this is what you're doing right now is being your best advocate by coming and participating in these kind of conferences and just, getting all the education you can regarding kidney failure, kidney disease, transplant versus dialysis ahead of time. Often what hurts potential recipients or patients is that they are so overwhelmed by the fact that they have this diagnosis that sometimes you overlook starting the education process because you are so overwhelmed. I've seen that with patients from time to time. So I can only say that getting the information as much as you can, through different avenues. I hate to say the internet, but the internet, speaking with your nephrologist and finding out what type of resource options he has for you or she has for you is going to be a great thing to do as well. Read up on kidney disease and finding out what steps are going to happen before you're going to need to start thinking about transplant versus dialysis. You
Fantastic.
have the control also to go and see the dialysis centers if that is your option. If that's your choice, you can go and look at some of the dialysis centers. They'll give you education on dialysis as well before you actually need to have an access place to start dialysis.
Great. I want to ask both Zachary and Ryan. I'll start with Zachary first. For you, what was the process of picking your transplant center? Did it just happen to be by default where you were, or was there any investigative work that went before this? Just explain to our community that whole process.
Yeah, so like I said before, I live in Rhode Island, and my nephrologist, I've gone to him since I had basically turned 18. I had assumed that Rhode Island Hospital would have been my transplant center, but my insurance actually wanted me to go to a different transplant center, and I had the choice between New York City or Boston, and I spoke directly with my nephrologist about which hospital he thought would be best, and he had actually been a nephrologist for Beth Israel Deaconess up in Boston, and he knew the team, so that was the choice I wanted to make, just because my nephrologist suggested that I go to this hospital just based on what my insurance wanted me to do.
Fantastic. And what about you, Ryan? Could you share your experience?
Yeah, I had my first transplant done at the University of Minnesota, so I had been followed by them since that time. When it came time for the second one, my two options living in Minnesota were either the University of Minnesota or Mayo Clinic. And, it kind of what Zachary was almost saying too, I had so much familiarity with the team there. And as you get into this process, you realize how important that team is. I keep hearing that come up. It came up this morning as well in the first presentation. And I trusted my team. I had an opportunity to meet with the surgeon and meet with the post-care folks. And, I was very satisfied with not only my first experience, but the care I was getting. So there really wasn't any desire to switch either.
Great. Now, Maddison, as you're the one who's most recently post-transplant, could you discuss a little bit about your follow-up, how many times you were seeing your renal team afterwards, and if you've experienced telehealth now during the COVID crisis?
So post-transplant, I believe for the first month, I went up, I'm from Connecticut, so my transplant team was in Hartford. So I went up, and at that time I was still with my pediatric nephrologist, but we were partnered with the adult transplant team, so we worked together with them. So I went up twice a week for a month, and one day I would meet with transplant and one day I would meet with my nephrologist. And then I believe it was after that first month, it really tapered down. I didn't meet with transplant anymore. I just met with my pediatric nephrologist, and then transplant would my surgeon would pop in now and again. So that was for the next like 3 months or so. After that, I did monthly follow-ups with my pediatric nephrologist. And then just this past April, I transitioned fully into adult with my actual transplant team that had transplanted me before. And I transitioned into the adult nephrologist that was with the team. And I did have a telehealth visit. My first visit actually with this new nephrologist was via telehealth. And it was fine. I actually, I navigated it quite well. And then I just met her for the first time last month in person.
Right. Fantastic. Thank you for sharing, Maddison. Ryan, as you've been post-transplant now for a while, could you let everyone know roughly how often do you go for lab work and to check in with your renal team to see how your transplant is doing?
I go every 4 months. I have an appointment, do labs, and then go have a quick, I say quick because it's quick. And my labs have been so stable that it's usually just a quick chit chat about how things are going, any concerns, and it's routine, but at this juncture in my life, I like routine. So we'll keep it that way.
Great to hear, Ryan. What about you, Zachary?
So right now, I also see my nephrology team once a month post-transplant. But I actually like to go get blood work done once a month just to reassure myself that everything is hunky-dory. So
Sure.
It's been a little different during the COVID crisis that we're in right now. I might go a couple extra weeks, but I'm going on Monday, so we'll see what my levels are then.
Yeah, it's funny. I'm actually going on Tuesday, but you're right. I mean, most places are obviously taking measures to make things a little bit safer for us, maybe staggering the appointment times and things of that nature. As we said before, us post-transplant folks do have to be more careful than the average individual during this global health crisis. Robbie, I have one more question here. It's very important, as we mentioned before, in picking a transplant center that's right for you. And sometimes you have to pick one based on what you need. Would you be able to explain to our community a little bit about what we call donor chains or exchange programs, and let them know what they are and how that might be an option to obtain a living donor donation?
Okay. So with the process of being evaluated as a recipient, once you're evaluated, you're going to be added to the waiting list if you're approved. At that point, any potential donor that you have, it can be anyone. It could be the mailman. It could be someone at the bank. It could be anyone, someone at church, whoever wants to donate or just simply be evaluated to donate can come forward. They would go online as far as with Cleveland Clinic and complete a survey. What happens? You don't have to worry about the blood group. We do look at blood group to determine whether or not there is a match. We'll actually take a sample from the living donor and the recipient and mix it together to see if the cells survive. If they do, then that means that you are a suitable match for each other. The living donor office, as we stated earlier, we talked about them being evaluated. If they're not a match, okay, if a recipient brings forward a person that wants to donate, not a direct match for the recipient, what happens is the recipient and the donor both go into what's called the National Kidney Registry. And there, in the National Kidney Registry, a match will be found for the recipient and the donor. Okay, so it's money in the bank. When you bring a donor forward, even if they're not a match for you, then it can help to have the recipient to receive a living donated organ. So that is called the Paired Exchange Program, also known as SWAP. There are also internal chains that occur where we just in January here at Cleveland Clinic, we had 16 chains, 16 participants involved, okay? What that means is any recipient that brought forward a living donor that was approved to donate, they may be donated to someone else in exchange. It goes on, so on and so on and so on. And that particular chain went up as high as 16. Once a donor is approved, a surgery will be scheduled, and it's not a matter of the donor giving to someone in January and the recipient receiving an organ in December. It's all within a matter of days apart.
Fantastic. Wow. We are running out of time here on our panel, so very quickly, I wanted to thank everyone on the panel for joining us today. I know one question we didn't get to answer was just, how do you let people know you need a kidney? And the biggest question is you have to let people know. You cannot suffer in silence. You have to put the word out there, whether it's on social media or just tell your family. Just get the word out there. Keeping that secret that you need a kidney doesn't help anyone. So don't be embarrassed to say that you need a kidney. There are incredible people out there. Obviously, some of us on this panel are living proof that there are living donors out there willing to make that sacrifice. So please keep that in mind. With that said, I would like to thank again our expert, Robbie. Thank you so much for taking your time today with us. All of our panelists, Ryan, Maddison, and Zachary, you guys have been exceptional.